Hi everyone, I would like to welcome you all to our workshop. Please feel free to ask anything and to participate. My name is Teresa Chuota. I'm the facilitator and I'm representing the maternal health advocates. And our topic today is going to be maternal mortality in Zimbabwe. Now is the time for you to introduce yourselves and tell us your name and where you're from. Thank you. Here's our program outline for today. We are going to look at what is maternal mortality, statistics of maternal mortality globally and in Zimbabwe, causes of maternal mortality, factors contributing to maternal mortality in Zimbabwe, how to avoid maternal mortality, and the conclusion. Now we're going to look at what maternal mortality is. Maternal mortality are deaths that occur as a result of pregnancy. These deaths occur during pregnancy, labor, delivery, or immediate postpartum period, with hemorrhage being the main cause. Now we will look at the statistics. About 1 in 6 women dies due to pregnancy in the poorest parts of the world due to weak health systems, high fertility, and poor availability of data compared to 1 in 30,000 in developed countries. Approximately 529,000 women die from pregnancy-related causes annually, and almost all, that is 99% of these maternal deaths, occur in developing nations. The maternal mortality rate in Zimbabwe shows an intolerably high and oscillating trend of 694 maternal deaths per 100,000 live births in 1999, 729 deaths in 2009, 614 deaths in 2014, to 650 deaths in 2016. Now we're going to look at the causes of maternal death. First, we have postpartum hemorrhage, which is excessive bleeding after delivery of baby, and is the leading cause of maternal death. We have eclampsia, which are convulsions caused by raised blood pressure in pregnancy. We have obstructed labor, sepsis, and also other causes, for example, malaria in pregnancy and abortion. Now we are going to look at the factors contributing to maternal mortality in Zimbabwe. We have poverty, high medical care costs in private medical centers. So the private medical care centers are very expensive, and due to poverty, the majority do not afford private medical care, so they opt for government care. And the government institutions, they are overcrowded, and that means the people, they won't get the medical attention as they need it. We have also religious influence. Some of religious organizations are against medical intervention. We have long distance, especially in rural areas. And lastly, long waiting hours in government or public health care centers, leading women to opt for other ways of delivery, for example, seeking help from untrained traditional midwives, where there is no professional care and no proper equipment, predisposing them to sepsis and other risks. But if we work together, all these maternal deaths can be avoided. Now we're going to look at how we can avoid maternal death. The first one is book pregnancies and book them early. We are encouraged to book our pregnancies as soon as we know that we are pregnant, and that will help to diagnose any problems early and to get to a proper care. Secondly, seek professional medical care when you are sick during pregnancy. Then lastly, deliver your baby at a medical center with qualified health professionals and proper equipment. Now we are going to look at the conclusion. A number of women die as a result of pregnancy. These deaths can be avoided if we book pregnancies early, seek medical treatment early when sick during pregnancy, and if we deliver our babies at medical centers where there's professional care. Thank you so much for listening. Now we're going to take a short break, and when we come back, it will be time for questions and discussions. Thank you so much.